So we can go through it that way too.
Okay, thank you.
Okay. So this is Module 2 in this series of 7. The first module, if you attended, was Early Warning Signs of Autism. And this is looking more at screening for autism. This was originally developed for pediatric residents, but certainly it's germane to anyone who uses the MChat and wants to be comfortable administering the MChat and the MChat follow-up interview. I learned at the last webinar there's actually an iPhone app that has the MChat on it, and I found that a little disconcerting just because not just do you want to have families answer these questions, but you want to have resources for them if concerns arise. So these are the learning objectives from today that were listed on the Envision website. As we discussed, the goal is to perform an autism-specific screening as recommended by the American Academy of Pediatrics, and we'll be focusing today on the MChat, which is the modified checklist for autism in toddlers. So with that, we want to review the AAP guidelines on autism screening at which well child checks this is recommended, discuss the importance of autism screening as part of developmental surveillance, so we'll talk a little bit about what surveillance is. Choose an appropriate screening tool, and one of your handouts has a list of several of these. Administer and score the screening tool correctly. And then secondly, what do we do with these results? We need a plan that supports the family and gets care for these kids. So interpreting the screening results correctly, explaining the results of screening to parents, and then formulating an appropriate plan of care. So why is the case that we're about to look at so important? The main reason is we know that early detection allows early access to early intervention, which is free or therapy through private services, and that leads to improved outcomes, long-term outcomes like better communication, better social interaction, and hopefully the ability to be in a mainstream school classroom. With this webinar were two separate cases. There was an 18-month-old, I believe, little boy named Matthew and a 2-year-old named Claudia. And just in the interest of time, I elected for us to follow through with Claudia's case. And if you all don't mind, we'll just read some of the germane pieces of that case. So put yourself in the place of a pediatric resident. Your next patient in continuity clinic is Claudia. She's a 2-year-old who has just moved to the area from another state. This is her first time to see you, her first visit to the clinic. As you introduce yourself to Claudia, you notice she stares at the door. You complete a physical exam and look over her immunization record. You ask Claudia's dad about preschool, and he replies that since Claudia does not speak yet, the family decided not to place her in preschool. You attempt to engage Claudia with toys, but she appears more interested in the buttons on her sweater. You go back to your preceptor and describe her concerning behavior and lack of words. You and your preceptor agree these may be signs of autism. After explaining the routine of screening for autism at the 18-month and 2-year-old visit, you give the screening tool to Claudia's dad for completion. So we're a pretty small group today. I hope you'll feel comfortable chiming in on the phone. But I just, you know, as you think about what that visit looks like with Claudia, what are some of the things that come to mind as red flags for you? Anyone, please feel free to comment.
This is Peggy. Her interest is not interacting with the proctor. Her just kind of zoned in attention to the buttons on her sweater, and that's her attention.
I'm not sure I heard everything, but right, so she's more interested in items or objects than in people, which is a red flag. Is that what you said? Yeah.
Yeah, yeah. You know, cause, you mentioned the fiddling with and kind of zoning into the buttons on her sweater.
Right, right. Exactly.
Not talking yet?
Exactly. So no language. And so last session we reviewed, you know, typical language developmental milestones for a 2-year-old. So she should have like 50 words at least. She should be putting short phrases together like want juice or go outside. She should know some body parts. She should look for things that are named. So, wow, that's a significant communication delay. And we don't know yet whether she's trying to compensate for it with nonverbal communication strategies. So exactly. Those are probably the two main things. You know, again, you can't interest her in toys, and it feels like she's looking at the door. And so she's, you know, that leads you to some concern about her eye contact as well. So one of our objectives is to understand the significance of developmental surveillance and developmental screening. And I know all of you who especially participate in DSI have this drilled into you from the American Academy. But I'd like to look at developmental surveillance, particularly as it is relevant to autism spectrum disorders. And I think you've all probably heard there are 5 components to developmental surveillance. Surveillance is considered the flexible, longitudinal, continuous, and cumulative process, it's a mouthful, of looking at risk factors for developmental delays. But let's just think about this in terms of autism. So the first one, eliciting and attending to parents' concerns about their child's development. This is some concern around, for example, is their child hearing? Is their child unresponsive, or do they have temperamental variations where they're irritable or passive, or do they have unusual sensitivities or food preferences, sensitivity to clothing, difficulty with transitions? What are the sort of behaviors that parents are concerned about? The second part is documenting and maintaining a developmental history, and hopefully you will have recorded milestones from infancy. So if you use the Ages and Stages questionnaire or some other type of developmental checklist, you will have paid particular attention to social and communication milestones like pointing, playing peekaboo, reciprocal play. So you'll have some record of what the child's been doing with that. The third part is making accurate observations of the child. For example, what's their eye contact like? Last session we looked at a number of examples of joint attention, which is sort of the shared focus of 2 individuals on an item of interest. This is sort of what we imagine the wide-eyed wonderment of toddlers sharing their world with us. And in Claudia's case, obviously, that's where that falls, that she was more interested in objects than people, or she maybe had restricted play patterns. The fourth thing is identifying risk and protective factors. That might be something like a family history of autism or a sibling with autism, which I was just reading increases the risk tenfold. So that is a significant risk factor for autism. And then lastly, maintaining an accurate record and documenting the process and findings. So those are all part of the developmental surveillance that is sort of the developmental standard of care for us in practice. Screening then refers to the use of a measure with proven reliability and validity administered in a standardized way, so like your Ages and Stages questionnaire, or for example the MCHAT. Any questions or comments so far before I go on to what the American Academy of Pediatrics recommends? Okay. So, the American Academy recommends developmental screening tests at 9, 18, and 30 months, or if you aren't routinely doing a 30-month visit, then at the 24-month visit. And then in 2006, they came out with an expanded policy statement. So we recommend, or to us is recommended, a standardized screening tool for autism at the 18-month preventive care visit. But we need to screen again at 24 to 30 months. We know about 30% of children who wind up with an autism spectrum disorder diagnosis may have had fairly typical development earlier. And in that percentage that regresses, we want to capture them with the second screen. So why would a screen be more informative or specific than a parent's history? And I think that really speaks to the fact that the screeners ask about these very subtle but critical aspects of social interaction that are the core features of autism, but may typically not be things that parents think about, like joint attention or eye contact or reciprocal play. They may see their kids as stubborn or late talkers or attribute it to something different, and I think this really helps us pick these kids up earlier. I think in your packet of handouts it might be labeled something different on the web page, but the actual title on the top of the handout is the screening tools chart, and this lists a number of screeners, including like the CAST, the MCHAT, the STAT, which actually requires some training. But if you look at the MCHAT, you can see that it's available in numerous languages. And there's also links to download the free templates and the scoring. So this is a handy handout, so to speak, for links to all those screeners. I will spare you the statistics class, I guess, probably because it was never a strength of mine, but we know that screening tools should be ideally sensitive and specific. So just a refresher. Sensitivity is the ability to identify correctly those that do have the disease, or in this case, autism, which would be the true positives over all positives, right? So that's true positives plus false negatives. And then specificity is those who, the ability to identify those that do not have the disease. So that's true negatives divided by all negatives, which is true negatives plus false positives. But the bottom line is that a sensitivity and specificity of 85% is considered acceptable. And as we'll see later on, being comfortable with the follow-up interview for the MCHAT really increases the specificity of the test. And it's free, by the way. So what do we tell parents when we hand them this screening that has the A word in the title? I think we really need to use our relationship with these families to give them an opportunity to discuss concerns. We're in really an ideal position to talk about strengths of the child, to help families with next steps. And so I think it is ideal that someone with a relationship be the one to give these screening tools rather than an iPhone app. But these are some of the reasons, or the reasons you can talk with families about. So we know there's a high prevalence of developmental problems in infants and young children, and that if they're found, there are a lot of potential interventions that we can introduce early. It leads to improved outcomes when we do that. These are standardized tools, so they're fairly reliable. We talked about when the screening is routinely done. And I think it's important for families to hear that the screening is not diagnostic. You know, a positive screen identifies a child at higher risk than one with a negative screen, but it does not provide a diagnosis. And so there's always room to have families have hope and more information, and certainly not to give a diagnosis based on the MCHAT. So I hope that you all have the handouts, because the next part is for us to go through Claudia's MCHAT. And we can talk as we score Claudia's about the questions and about the scoring. So the handouts you need for this are handout 5 and handout 6. And they might be labeled again something different on the website, but this is what it should say at the top of the page. Does everybody have those available to them?
I have, I don't know if it's 5 or 6, because I have what I see on the screen right now. This is Peggy, the police score, colleagues.
So it should say MCHAT form for Claudia and MCHAT scoring instructions.
The case study part 2.
Everybody else have those? Pam, were you able to link? And Judy and Becky, do you guys have that?
I see a screen that says Case Study Part 1, Activity, Scoring the MChat Screener.
It should be, I think it would probably say handout like 3 or 4 on the web page, but on the top of the paper it says handout 5 and handout 6, if that makes sense. It looks like a list of 23 questions with Claudia's name at the top.
Oh, I am not seeing that.
I don't have that. Can we go back to the web page online?
You should be able to, yeah.
Do you want to pull it up here?
Sure, let's do that. Thanks, Kevin.
Sure. And bear with us for just a minute here. We'll download those guys.
Good luck just going to the calendar too and hitting on the calendar.
Yeah, that's where I'm heading for some reason.
Our computer is having a snow delay also. Sorry.
There we go.
Perfect. I think it's either 3 or 4. Let's try that.
Let's try 3.
Should have matched them up. Okay, so it's the next one.
Next one. So on the website, it's the one labeled Handout 4.
I think. Let's look at it.
That's our best guess. This one?
No.
Hey.
So I'm looking at the calendar, and I've clicked on to Screening for Autism.
Mm-hmm.
Right?
Okay, so that's
and
the first
so
one.
I'm sorry, it should say... Should it say, I'm sorry, which handout is this?
Actually, we're not
Hello?
sure yet.
Oh, okay.
Because we'll need that one too.
And that one too.
Actually, we won't need that. We need that one. So
This one,
what
yeah.
you see on our website right now, you're going to need, which one was that on the thing? Is that 5?
This one?
Yeah. But what did it say on the margin? 5?
It was 5.
So you're going to need case handout 5 on your, red column to the left.
Okay.
I don't know where Claudia's is. That's weird. Seemed like I opened them. Yep. So let's look at 6 and 7. Or 7.
So I did 6 already.
This should be Claudia's follow-up interview. Well, if you all have a blank MChat and the MChat scoring, I can read you the responses that, that's the follow-up interview, so if you can minimize that one too.
Okay.
We can just go ahead. Do you guys have the MChat scoring instructions and either a blank MChat or Claudia's MChat?
I don't. This is
You
Pam.
don't. Okay. Well, we can just put it up on the website then, right?
We can just put it up here, yeah.
Yeah.
So, which one was it?
Oh, whoops, whoa.
Yeah, let's just use that.
Oh, magical.
That one, okay.
We need them. Can we put them side by side, or that won't work? Is that too little for you guys? I apologize for our technical difficulties.
That's not gonna work.
So when we go to the second page, oh, where is that? There's no chat. Okay. There. Okay.
That's the one?
Mm-hmm.
It's gonna be pretty stuck.
Okay, bear with us. Hopefully you're still there. And hopefully on your computer screen for the website you can see on the left handout 6 MChat scoring instructions and on the right screening for autism. Is that something you guys all are looking at?
This is Peggy on a split screen, but I can barely read the MChat on the right-hand side.
That's okay. I'm going to read it to you because I'll tell you what Claudia's parents' answers were. So,
Great.
Again, sorry for the technical difficulty. So, this is the screener that you hand to parents, and you can see the scoring on the left, and there are some answers that are bolded. Those are considered critical responses. So, when we get to scoring, these are the more heavily weighted questions, and you can send away for screening scoring. It's like a clear overlay that you put over the MChat, and it'll show you what the correct responses are and then which the critical items are, and that's a little handy thing to have when you're scoring MChats. There's also some electronic decision support systems like Chattis. I don't know if you guys have ever heard of. It's a capital C, capital H, capital A, D-I-S, the Child Health and Development Interactive System. And if you're a member of that and you use their electronic program, it'll score the MChat for you and also bring up the items for the follow-up interview. So just in the interest of time, let's quickly go through Claudia's MChat, and you can see that her dad had some concerning responses. Does your child enjoy being swung, bounced on your knee, etc.? Claudia's dad said yes. Does your child take an interest in other children? He responded no, and you can see that's a critical item. She had no interest in other children. Does your child like climbing on things such as stairs? Yes. Enjoy playing peekaboo and hide and seek? Yes. So we're on 5 now. Does your child ever pretend, for example, to talk on the phone or take care of a doll or pretend things? He responded no. You can see that's not typical. Does your child ever use his or her index finger to point and ask for something? No. Does your child ever use his or her index finger to point to indicate interest in something? Again, he responded no. And that's another critical item. So pointing to show interest is considered much more concerning if it's absent. Can your child play properly with small toys without mouthing, fiddling, or dropping them? No, was his response. So she doesn't play with toys in a typical way. Does she ever bring objects over to you to show you something? No. So she's not showing, she's not pointing things out. She's really in her own little world. Does your child look you in the eye for more than a second or two? No. Does your child ever seem oversensitive to noise? No. Number 12, does your child smile in response to your face or your smile? Yes. Does your child imitate you? For example, if you make a face, will your child imitate it? He answered no, and that's another critical item. You can see that's bolded. Does your child respond to his or her name when you call? No, another critical item. If you pointed a toy across the room, does your child look at it? He responded yes. Does your child walk? Yes. Does your child look at things you are looking at? Yes. Does your child make unusual finger movements near his or her face? No. Does your child try to attract your attention to his or her own activity? Yes. Have you ever wondered if your child is deaf? Her dad put a question mark. Does your child understand what people say? No. And lastly, does your child look at your face to check your reaction when faced with something unfamiliar? And he again put a question mark. So I know that you guys don't have that in front of you to score, but she, I hate to use the word failed, but that's the terminology. She failed 4 critical items and 6 of the other items. So obviously her MCHAT is in a very concerning range. Can I just X out of this, Kevin?
Mm-hmm. If you're done.
So we scored her MCHAT and we're worried. And you guys have been listening to me talk for quite a while. So, that one. We're going to look at just some videos because it's always so much nicer to look at videos than to hear people talk. And this is a video of typical children, about a minute long. Just watch the way they look at each other, imitate each other, and they demonstrate such lovely joint attention. So the video's a little small, but you can sort of see them referencing each other back and forth and imitating what the other one is doing and babbling.
Mocha. Okay.
So clearly little guys who are taking an interest in what other toddlers are doing, an interest in other children. This is a video from the last module. This is a therapy session of a child with autism, but just to sort of show you how difficult this child is to engage and how persistent the therapist needs to be.
Tashi, touch your head. Yeah, that's right. Good working. Sashi, touch your head. Sashi, touch your head. Let's try again. Sashi, touch your head. No, you didn't. Have a circle. Okay. Sashi, touch your head. Good for you. Sashi, touch your head. Oh, that's my boy. Good working.
So you can see he's never really referenced her with his eyes. Even when he successfully put the shape in the shape sorter, he didn't really look at her like, see what I did? So you can see that that's difficult for him. And this is, I think, another typical example of imitation, just because I thought you guys might like to see some more typically developing kids.
Let's make some ice cream. Stir. Stir it up. Ooh, it's delicious. It's so good. That's good. I'm going to get some more. I want some chocolate. Ooh, delicious. That's chocolate. Lots of chocolate. Put some in too. You want some more chocolate? Here's your ice cream cone. Delicious. Here.
What flavor ice cream do you have, guys? Does that mean strawberry?
Strawberry spread.
Oh, it's strawberry cookie chocolate.
So even especially the first little girl who really looked young, you know, she was able to imitate, to pretend that something was something other than what it was. She showed some joint attention and imitation and eye contact. So this is the second part of the case. Some of the answers he's not sure about. You've scored it as we discussed, and she missed 4 critical items and 6 other items. And so you talk with Claudia's dad that some of his responses about Claudia's behavior have raised some concerns. So I think what we'll try to do then is pull up the follow-up algorithm from the handouts and just show them on the computer screen rather than having you try and match the handout. I think it's 6 or 7 on your menu, but we'll just pull it up here as well. It's that one. Thanks. So will that go full screen, or is that?
Yeah, you
like
could.
this?
Yeah, let's maximize.
I can just scroll it.
Yeah, maximize.
Okay. And then how do I scroll it up and down? Yeah, there's stuff there. Okay. Okay, so are you guys hanging in there with me? Sort of? So the follow-up interview can be done in person or by telephone, and it uses a script, as you'll see, that's very deliberate. I was trying to make it so you could see more of it at the same time. Yeah, perfect. Thank you. So there's a number of reasons why the original MChat can have some false negatives and some false positives. And these are things like the parents aren't really understanding the questions, or there may be another developmental delay or unusual development in place, or the child may have a vision or a hearing deficit. So there are other reasons why the MChat can be positive. So doing the follow-up interview really increases what we call the positive predictive value of the MChat screener. And the literature shows that it takes it from 11% to 65%. So the follow-up interview is worth the time that you invest in it. But it is fairly tedious, and you can see that for each missed question, you go through this long algorithm. So we may not do all the ones that Claudia missed, but let's just do a couple so you can sort of get a flavor for what this looks like. And also attached to that handout page is a complete follow-up interview for questions 1 through 23, because obviously your kids may not miss the same items that Claudia missed. So you start out, you reported Claudia does not take an interest in other children. That was item 2. You first find out, is that still true? If they say yes, then you ask them more specific examples, such as when you're at the playground or supermarket, does your child usually respond to the presence of another child? If they say no, then it's a failed item. But if they say yes, then you ask them specifically, how does your child respond? Do they play with another child, talk to another child, show aggressive behavior, vocalize, smile, or look? If they say yes to any of these, then you ask if they do it more than half the time. So you can see it's very specific about asking what's really happening. And as parents complete these follow-up questions, it gives you some really nice examples to talk to the parents about when you're talking about why you're referring, if you choose to do that. Another item that Claudia missed was item number 5. You reported that Claudia does not ever pretend to talk on the phone or take care of dolls or pretend other things. Is this still true? In her case, yes. Does she ever play make-believe? If yes, you ask for examples. If yes, you ask for an example. If no, you ask these examples specifically. So you're asking even, do they push a car? Play with imaginary food, pretend to vacuum, feed a toy or theirself with an imaginary or empty cup, feed a doll. You can see that these are just the very beginning play skills that a toddler would show, and you're just asking for very specific examples. And again, you go down the algorithm to pass or fail. So let me just pause for a second and ask, there are 10 of these. We can go through all of them if that's how we choose to use our time. Or you can read through these algorithms on your own. Do you guys have a preference for what we do?
Peggy,
You want me to
I have
keep...
no preference.
No preference? You want me to keep going with these?
Yes. This is Pam.
Okay, I'll keep going, Pam. Thank you. So number 7, I believe, is another critical item. You reported that Claudia does not use her finger to point or indicate an interest in something, and as they note, it's a critical item. Is this still true? Yes. So then you ask for specific examples, because most toddlers will at some point point to something like this. Does your child ever want you to see something interesting, such as airplane, a truck, a bug, an animal? If they say yes, then you go down the left side of the algorithm. How does your child draw your attention to it? Would he or she point with his or her finger? If they say yes again, you need to clarify, is this for interest and not to get help? Because it's still a fail if they're only pointing to get help and not to share interest. So it's again that very important feature of joint attention and shared interest. Question number 8, Claudia does not play properly with small toys, and this is still true. So how does she play? And there's some pass ways to play with toys and some fail ways to play with toys. And these are the kinds of questions that we ask when we're seeing children for the more tertiary evaluation as well. So passing is playing with toys typically like stacking blocks, simple puzzles, cars and trucks, playing with a shape sorter, nesting cups, things like that. Now, also, sometimes kids with an autism spectrum disorder have some terrific visual motor splinter skills, and they can be very good with puzzles and the visual aspects of toys. So it's important to sort of get a feel for how kids are playing. The failed items are kids don't play with toys, or they play atypically, like lining one toy up or having an emphasis on one toy that they carry around the house, or they swallow pieces, which never makes pediatricians happy. So again, the algorithm to pass and fail. And if they have examples from both, then what you need to know is which is more typical. Do they more often play with toys typically, or more often not? And you can see that this interview can take quite a while. Another critical response was that Claudia does not bring objects to show. Is this still true? Yes. And these are the types of things a typical toddler might show a parent. A picture or a toy, a drawing, a flower, a bug, really anything that interests them. So again, you make that distinction. Is this just to show you and not to get help? And if it's just to show, it's a pass. And if it's just for help or they don't bring you things, it's still a failed item. Item number 10 is about eye contact for more than a second or two. Now, Claudia's parents said it wasn't still true, that she had improving eye contact. And that's actually something that you can say is a very encouraging thing when you're talking with the family about your overall concerns. If it were still true on the follow-up interview, you ask about a number of scenarios when a child may give you eye contact, such as when they need something, when they're eating, when you're changing their diaper, when you're telling them a story. And again, it tries to quantify it. Yes to 1, yes to 2 or more, or no, not at all. So you can see that if they do 2 or more of these, it's a pass. And if it's only 1, they ask about every day, and then every day at least 5 times. So I'm not sure where these numbers come from, but they're very specific in terms of trying to quantify what's going on with a pretty subjective behavior. Here's another critical item, imitation. Imitation is so key to learning, and it's such a frequent core deficit we see with autism. So these are some of the things that a child will typically imitate, and it's still a concern for the family. So you ask, does she copy you if you make a funny sound, wave goodbye, stick out your tongue, clap your hands, make the shh, be quiet sound, or blow a kiss? If it's 2 or more, then you pass. If it's 1 or none, then a fail. Another critical item is response to name. And again, the parents endorsed that this was not still true, that she sometimes was responding to her name. However, they qualify it if she's paying attention. So it's just sometimes, really. And so then you go down the right-hand side of the algorithm, like what do you have to do to get your child's attention? You need to be in their face, you need to touch them, they sometimes ignore you. And if there's examples from both sides of the algorithm, then again you ask which is more typical. You guys hanging in there with me? Number 20, have you ever wondered if your child is deaf? They were uncertain about this answer, so this gives you an opportunity to ask where this concern came from. If they say no, they're not concerned, that's a pass. If they frequently pay attention to sounds and to people, then they pass, and otherwise they don't.
Sorry,
just a couple.
Disconnect.
Sorry?
Oh no, I'm sorry. I was I disconnected myself, and you were asking about how we were doing. But no, go ahead. I'm sorry.
Welcome back.
Sorry.
No worries. You reported that Claudia does not understand what people say. Is this still true? The parents endorsed yes. So then it gives you a number of scenarios where a child might typically understand directions like go get your shoes, dinner's ready, bring me a book, bring me my keys, and you can follow the algorithm through based on yes, no, or sometimes, and if consistently children are not following directions, then that's considered a failed item. Wanders without purpose, still true. So this kind of undirected behavior, they don't really have that social engagement to tether them to a play activity. And a lot of times kids may not have stranger anxiety, so sometimes they can be very brave and wander, and this question speaks to that. The second part of the question, does he or she like to walk around the edges of the room instead of settling down to an activity? Yes, that's concerning. And so if that's the case, then you ask, does he have that behavior at least several times per week? Or does he walk in circles at least several times per week? And again, you follow that through to a pass or fail answer. Lastly, you reported Claudia does not usually look at your face to check your reaction when faced with something unfamiliar. Is this still true? Yes. So children, visually and physically frequently check in with their parents in unfamiliar settings. So they look at their parents to decide how to respond, and it sounds like Claudia really isn't doing this. She doesn't look at her parents when someone new approaches, when there's something unfamiliar or scary, and may have a tantrum. So again, most of these items on the follow-up interview were validated for Claudia. Oh, I keep doing that, Kevin. Sorry. So now you sort of, as Barbara Howard says, you take the big gulp, kind of, because you have to talk to parents about this really difficult piece of information that you want to refer to multidisciplinary team or to early intervention, and that you're concerned about autism as a potential diagnosis. And you can really say something like, sometimes children who are not interested in things have a problem like autism. And we have good ways to teach a child these skills, but first we need to make sure this is a problem for him. So there are ways you can present it so that you can say, I hope I'm wrong, but we need to find out. You need to leave essential room for hope with families, but I think if you can sit down and tell them honestly you have concerns, that there are a number of things that it could be, and autism is one of them, and then again go through the strengths, like for instance, sometimes Claudia points, sometimes she has eye contact, she's gaining new skills, her motor skills are on target. You can find the positive things to talk with the parents about to sort of help ease this conversation. And actually all of the third module that we'll do next time is about conveying the information about your concerns to families. But these are your next steps. You want to make sure that a child is hearing normally, and so if you haven't completed OAE or hearing tests, please refer them for audiology. If they're not in EI, please refer them to EI. You know, sometimes there's a waiting list for a developmental evaluation, and that gives them time in early intervention, a few critical months before they see our team. So these are the steps in referral. I think we've honestly gone through most of the case in the follow-up interview. I just want to call your attention to the last paragraph where it says you schedule a follow-up visit with Claudia and her parents in 2 months to continue to follow her progress and to ensure that services and assessments are underway. It's not uncommon for families to not keep the follow-up appointments that you recommended. It takes a lot for families to take their kids for an evaluation or to engage in early intervention and let people into their home. And so not letting Claudia wait a long time before you see her again and check in with the family, encourage them to really follow up with the evaluation. It can be really critical to do that. So I guess I would pause for a second. I have one more video interview with the mom to show you about just how important it was for her pediatrician to talk with her about this diagnosis and set them on the path. But I'd just like to ask you guys what your experience has been with the MChat, if you're administering it, and whether you have any specific questions about it. Anybody?
This is Peggy. I work with Child Development Watch in Delaware, and normally our developmental pediatrician does the MChat or the family service coordinator. I do assessment. So a lot of times the MChat is done, and then when there's concern, red flags showing, they schedule a 5-domain assessment through our agency at Public Health, and that's how the MChat and the autism all and play into my job as an assessor.
Great. So are you you're doing the follow-up interview then?
Your are very good. I'm sorry. Pardon me.
Oh, I was just asking if you're doing the follow-up interview then. Do you use the follow-up interview?
I know that if there are concerns, and then after the assessment is done, a parent re-interview with, then they do sometimes use the follow-up, and sometimes they don't. Probably because of the answers from the interview and stuff they're getting and putting all the information together.
Sure.
Or maybe we've had, when you had the hearing concerns, it's like, oh yes, that has happened 3 or 4 times where the child had multiple ear infections or blockage, needed tubes. The parents just didn't realize it because the child read the parents' cues, busy family environment, different reasonings, and it was a hearing problem. So that's just an important point. And also, I've seen it and doing this, but you have very good key factors, key points that I really appreciate as you're doing these these webinars. Really good information, and the handouts. Unfortunately, I didn't get them all, but I will when I get done.
We'll try to fix that. Thank you. This was a very handout-dependent presentation because of all the algorithms, so I hope that you'll have time. And again, if you want to practice with another case, there's a case of a little boy. That's really a great case. I just knew we wouldn't have time for both of them today. So that's available on the Autism Case Trainings website. If you just Google ACT and CDC, the whole training will come up. So.
Sorry, what was that?
It's, if you Google, we should probably have it. If you Google ACT and CDC, all the modules and all the videos and all the handouts are right there. Pretty amazing. So I can, yeah, I don't know what the actual website address
is. Let's see.
I could this is Peggy. I Googled after the first one, the CDC.com, and they had, found that there was a thing about the act.
Yeah.
Very user-friendly.
Yeah, the easiest way to do it, I just did ACT and CDC, put that into Google, hit return, and it's the first thing that comes up.
That's the first thing that comes up.
Yeah.
And then you guys won't even need me.
Computers, but it was very easy to navigate.
Well, this is Pam, and I haven't used it, but I'm interested in learning how to use it.
Uh-huh.
And I would like to know, well, I would need permission from the person that I'm contracting with, as well as the family, of course. But when I begin to do that, can I call who for support around questions that I might have?
Sure, you're welcome to call me Pam. I have to tell you the truth. We usually see kids on the other side of the referral, so we don't use the MChat. But if I can't answer your question, I'll try and track down someone who can. So you're welcome to call me.
Okay, thank you.
Yeah. So I know we're almost to the witching 1 o'clock hour. I just want to play you this one mom's comments about how appreciative she was and just sort of how the process went for her. And this will help us segue into the next module about sharing these, this difficult information with families, which is sometimes the hardest part. So this is just a mom's comments about the process.
Our pediatrician was wonderful. She was very old school and very direct. She didn't sugarcoat anything for us, which I appreciate now. Back then it was hard to hear, but she did recommend that we have him assessed by early intervention for speech. This was for Gabriel, and she did recommend we take him to a developmental pediatrician. It was early intervention who informed us of, I guess, the scattered skills in all the areas that were delayed, and our developmental pediatrician as well. But we saw the early intervention team before that because we had the waiting list for the developmental pediatrician. I would not have had a clue if my pediatrician, I never even heard of early intervention before that. Didn't know the system, never been exposed to special needs kids. I probably wouldn't have known until she would have said something when he was 2 years, 2.5 years. I would have just kept thinking, some children don't talk until they're 4 or 5. He's just one of them.
So if you do find after completing an MChat that you would like to refer, I know there are some private evaluation places as well. I think there's a developmental pediatrician at Presbyterian. This is just contact information for where I work, and also for the autism clinic for kids who are older, so it's a resource to you. There was a question that came in online about would we recommend completing an MChat over a few visits at home. I think the questions on the MChat are very evocative and very helpful in sort of informing our support for kids. To me, it seems like your comfort with the MChat just surrounds what you're going to do with the information if the answers are concerning. Do you feel comfortable talking with families about autism as a possible diagnosis and making sure that you can support them in the next steps? Or do you want to, if you're not their primary care provider, do you want to pull that person in and say, look, I went through this and some of the answers are concerning to me about development. Would you want to talk to your pediatrician about this? So I think there's always support for you in any discipline around the MChat and the results. So I know it's 1 o'clock and some people may need to sign off. I'll certainly stay if there are questions or comments, but if you need to sign off or if we want to do roll call one more time, then I'll stay after that. Does that sound okay, Kevin?
That sounds great. Yeah, let's go ahead and do a roll call here real quick, and then we can take any questions you might have. So whoever's out there, go ahead and say your name.
Pamela Siegel.
Becky McKernan.
Judy.
Terry Peterson.
Sarah Motzkus?
Let's see, somebody is got a hot mic there. Okay, I was able to mute you. Let's see, 770.
Peggy, come here just a moment.
Peggy, I've got you. With some.
Okay, thank you.
Thank you, Peggy. Who else do we have out there?
Corey Contreras?
Corey Contreras?
Yes.
Okay, thanks.
There's a group of us from out at Pueblo of Laguna.
Oh, okay. Who all do you have there?
We have Ed Chermaya, Susan Tharp, Dorothy Weiseman, Elizabeth Martinez, and Sally Trujillo.
Okay. Did everybody there sign up for the webinar?
I was the one that signed up, and then they just all sat in with me.
Oh, okay, gotcha. And what's your name?
Susan Tharp.
Oh, there you are. Oh, okay. Okie doke. If you would, you might want to email me whoever was the email addresses and names of whoever else was there who wants to get CEUs or CMEs. I'll need to have their information to give to our coordinator.
All right. Thank you.
Thank you. Do we have Sarah Motzkus or Judy Ledman or Chuck Ivy out there?
Yes, Chuck Ivy and Carrie Peterson. We're here still.
Oh, good. Okay.
This is Judy Ledman and
All right.
Rebecca McCann.
Are we wearing you out, Judy? I'm sorry.
No, we'd already given our names, but I guess you didn't hear us.
Gotcha. Yeah, there was a lot of overlap. I'm sorry about that.
No problem.
Okay.
Okay.
Well, thank you all so much for attending, and if you need to sign off, go ahead, and I'll just ask if anyone has any other questions.
Thank you, Mareth. Yes,
Thank you,
Mareth.
Judy. Thanks, Becky.
Thank you.
Okay.
Okay, a lot of people have jumped off. If anybody else has any questions, please feel free. Well, with that, without further ado, thank you, Mareth Williams, for your presentation. It was excellent. And thank you all for participating. We will see you next time. Keep an eye out on envisionnm.org on our calendar for our next session and for all of our other webinars. Thanks again.